Hi friends, welcome back to another video from Curious With. The topic for today is Pyometra in small animals. So here we will see what is Pyometra, the etiology, clinical science, diagnosis and different treatment options of Pyometra in small animals. So let's begin. What is Pyometra? Pyometra is a hormonally mediated diestral disorder characterized by CEH or cystic endometrial hyperplasia with secondary bacterial infection. Pyometra is reported primarily in older bitches more than 5-year-old, especially 4 to 6 weeks after estrus. You can see a Pyometra uterus removed after ovary hysterectomy here. Then factors associated with occurrence of Pyometra include administration of long-lasting progestational compounds to delay or suppress estrus, administration of estrogens to mismated bitches, or post-insemination or post-copulation infections. What is happening with the progesterone induction? Progesterone promotes endometrial growth and glandular secretion while decreasing the myometrial activity. And cystic endometrial hyperplasia and accumulation of uterine secretions ultimately develop. And this provides an excellent environment for bacterial growth. Progesterone also inhibits the WBC response to bacterial infection, thereby worsening the situation, and bacteria from the normal vaginal flora or subclinical urinary tract infections are the most likely sources of uterine contamination. Escherichia coli is the most common bacterium isolated in the cases of Pyometra, although Staphylococcus, Streptococcus, Pseudomonas, Proteus species and other bacteria also have been recovered, but the most common bacterium isolated in cases of Pyometra is E. coli. Now what about the queens? Queens require copulatory stimulation to ovulate and produce progesterone from corpus luteum, as we all know. So, because of this condition, Pyometra is less common in queens than in bitches because they require a copulatory stimulation to ovulate and produce progesterone. Administration of medroxyprogesterone and other progestational compounds has been associated with development of Pyometra in bitches as well as queens. Pyometra can develop in uterine tissue left after ovary hysterectomy, and that is a condition called stump Pyometra, where the Pyometra develop in the uterine tissue left after ovary hysterectomy. And it can also occur secondary to postpartum metritis. By itself, estrogen does not contribute to the development of endometrial hyperplasia of Pyometra. However, it does increase the stimulatory effect of progesterone on the uterus. And administration of exogenous estrogens to prevent pregnancy or mismatched shots during diestrus generally increases the risk of developing Pyometra and should be discouraged. Now let's see the clinical signs. Clinical signs are seen during diestrus, usually 4 to 8 weeks after estrus, or after administration of exogenous progestins. And the signs are variable and include lethargy, anorexia, polyuria, polydipsia and vomiting. This is a healthy uterus compared to a uterus with Pyometra. And there are two conditions. One is open Pyometra and another is closed Pyometra. And in open Pyometra, the cervix is open and a purulent vulvar discharge often containing blood is present. And in closed Pyometra, where the cervix is closed, there is no discharge and the large uterus may cause abdominal distension. Signs when progress rapidly to shock and death. And physical examination reveals lethargy, dehydration and uterine enlargement. And if the cervix is patent asanguineous to mucopurulent vaginal discharge, only 20% of affected animals have a fever and shock may be present. The leukogram of animals with Pyometra is variable and may be normal. However, Leukocytosis characterized by a neutrophilia with a left shift is usual, and leukopenia may be found in animals with sepsis. A mild normocytic, normochromic, non-regenerative anemia with a PCV of 28 to 35% may also develop, and hyperproteinemia due to hyperglobulinemia may be found. Results of urinalysis are variable, with E. coli infection, isostenuria due to endotoxin induced impairment of renal tubular function or to insensitivity to ADH, or both may develop. A glomerulonephropathy caused by immune complex deposition may result in proteinuria. These renal signs are potentially reversible once Pyometra is resolved. Now let's see the diagnosis. Pyometra may be suspected in any ill diastral bitch or queen, especially if polydipsia, polyuria, or vomiting is present. Anyway, the diagnosis can be established from history, physical examination, abdominal radiography, and ultrasonography. Here you can see an abdominal radiography in lateral projection of a Norwegian L count 10-year-old with Pyometra. We can really appreciate the distended uterus in the lateral projection here, in the caudoventral abdomen. This is another picture of ultrasound of Pyometra in a cat. So anterior dorsal to the kidney, you can see the uterine horn distended with fluid, which is the best diagnostic option for Pyometra. And vaginal cytology often helps to determine the nature of vulvar discharge. And a CBC, a biochemistry profile, and urinalysis help exclude other causes of polydipsia, polyuria, and vomiting. They also evaluate the renal function, acid-base status, and septicemia. The uterine exudate should be cultured and sensitivity tests can be performed. And now let's see what are the differential diagnoses, which include pregnancy and of course other causes of vulvar discharge, polyuria, polydipsia, and vomiting. Now let's move on to the treatment and prognosis of Pyometra. The best choice is ovariohysterectomy, that is the removal of the infected uterus with both the ovaries. So here you can see the picture of a uterus removed after the OVH. In a Pyometra case, the distended uterus is really appreciable here. But before surgery, we need to do certain things. That is, fluids, IV and broad spectrum antibactericidal antibiotics should be administered. Fluid, electrolyte and acid-base imbalances should be corrected as quickly as possible before OVH is performed. The bacterial infection is responsible for the illness and will not resolve until the uterine exudate is removed. Oral antibiotics based on the result of culture and sensitivity should be continued 7 to 10 days after surgery. Medical therapy with prostaglandin PGF2 alpha can be used for animals to be bred in the future, although prostaglandins are not approved in the USA for use in cats or dogs. Prostaglandin causes luteolysis, contraction of myometrium, relaxation of cervix, and expulsion of uterine exudate. They should probably not be used in animals more than 8-year-old or in those not intended for breeding. The delay before clinical improvement and many adverse effects of PGF2 alpha preclude its use in a severely ill animal, and PGF2 alpha also should be used with caution in bitches or queens with a closed cervix Pyometra because of increased risk of uterine rupture, and pregnancy must be excluded because it causes abortion. Naturally occurring PGF2 alpha is commonly used at a dose rate of 0.25 mg per kilogram per day subcut for 5 days, and synthetic analogs are much more potent than natural ones and have been used to treat Pyometra in dogs. Broad spectrum bactericidal antibiotics chosen on the basis of culture and sensitivity test should be given for more than 2 weeks. The adverse effects of PGF2 alpha include restlessness, anxiety, panting, hypersalivation, pacing, tachycardia, vomiting, urination, and defecation. And other antiprogestins like algeprostone is also used to treat bitches with closed cervix pyometra. After medical therapy, prognosis is for the initial resolution of pyometra is good if the cervix is open but guarded to poor if closed. Of those animals that respond, as many as 90% of bitches and 70% of queens with open cervix pyometra may be fertile. Recurrence is likely, and 70% of bitches treated with treated medically for pyometra had recurrence within 2 years. Therefore, the animal should be bred on the next and each subsequent cycle until the desired number of puppies or kittens may be produced and then spayed. Prostaglandins should not be dispensed for owner administration because of the narrow safety index and the potential to trigger asthmatic events and pregnancy loss in people. So that's all about pyometra. We discussed about the causes, then clinical signs, diagnosis and treatment options. So if the video is informative and useful, please like it and share it with your friends, comment your suggestions. If you are new to this channel and not subscribed yet, please subscribe and click the notification bell so that you get notified every time I upload a video. See you soon with another video.